A bit nervous to follow Michael, to be honest. He's such an interesting talk. So I'm Clare Wyld. I'm a GP working in Oxford. And Kathy's right, I did a diploma at the College of Naturopathic Medicine in naturopathic nutrition, which I finished last year actually. So I feel like I've got a bit of a nice perspective on both sides of the kind of health and well-being world. So I'm really honoured to be speaking here today, and thanks to Nick for asking me to. It's really nice to feel that us doctors are included. And my one message, I suppose, is that we're not all bad. We're doing our best. The NHS is under extreme pressure at the moment. We've got not very many resources and not much time, so just give us a break occasionally. But let's have a look at the NHS and, I don't know, its possible future. So obviously I don't have a crystal ball and I'm not quite sure what's going to happen, but just going to look at a few things about what's going on now that may predict a little bit of what might happen in the future. So going to have a very quick look at the past. We'll look at some facts and figures relevant for today and possibly what the future might hold, and also what we can all do to help. Excuse my voice, I've got a really bad cold. I'm not exactly the picture of health today. So the NHS, as you probably know, turned 70 this year. It was set up in 1948 to provide free healthcare for everyone at the point of access. So this was kind of an attempt to remove any barriers to healthcare in those days, and even out the health inequalities that there were in Britain, and still are. So there have been enormous advances in healthcare over the past 70 years. Some of you can see here. Well, probably not, but anyway. So I don't know how much of that you can see, but there's, lots of things have happened. I won't go into too many of them. And over the past 10 years, there's been a slight shift, I'd say, in public health towards lifestyle and preventative health strategies. So there was the Change for Life campaign launched in 2009, and probably most of you would recognise those cartoons. I think the television presence was quite big, and there's still quite a lot of leaflets and things floating around GP surgeries. And NHS health checks also were launched around the same time, which is an annual health check for people over the age of 40. So looking at BMI, blood pressure, cholesterol. I don't know if anyone in the audience has had their health check. No, you don't want to admit it. And then in 2016, so there was this One You campaign that was launched, but I'm not sure how much of a success this was or is. I must admit I hadn't heard of it, and quite a few of my colleagues, hadn't either. Hello? Is that any better? Thank you. Sorry. Can you hear me? Is that any better? Yes. So anyway, I don't know how good it is, but there's quite a useful website for patients to go on. You can take a little quiz to see how healthy you are. And there's some tips on giving up smoking, losing weight, and that kind of thing. I'm just not sure whether the message is really getting through. So what does the present look like? Something a bit like this. These are all kind of from the last year. And it doesn't feel like there's a week that goes by when there isn't some awful headline about the demise of the NHS. And maybe they're not wrong. I know where I work in Oxford, funding is a huge issue. Some of the services are at their worst ever. I went to a conference last week on women's health. We had a consultant gynaecologist come to talk to us. He said he opened his lecture with an apology about how awful their service was. He said he's never ever had to do that before in his life. Things are really difficult. Oxford particularly is a bit of a problem, he said, because it's such an expensive place to live and nurses can't really afford to live there. So we've got a huge shortage of nurses. Keeping services going is really difficult at the moment. So what are the other reasons for it? So we are living longer. There's more chronic disease than there ever has been before, as Nick has already touched on. We lived in extremely stressful lives, in an extremely stressful environment. We don't have communities like we used to, I don't think. Our food choices can be really poor. Cheap food isn't great for us. And, you know, the usual things, money and time are really tight. So one of the issues is the levels of preventable diseases, and that's putting a huge strain on our healthcare system. So globally at the moment, non-communicable disease, so that's all the kind of chronic diseases, so not infections, not maternal, problems at birth and things like that. Non-communicable diseases now account for 70% of deaths in the world, this is. So even in the last 16 years, I know you might not be able to see very well the graphs here, but the top one is ischemic heart disease. So even in the last 16 years, that's gone up hugely. And the red ones are the sort of infections and things like that. And they've been replaced by more of the blue ones, which is the non-communicable chronic disease. So that's quite a big shift even in a relatively short space of time. Particular problem is in higher income countries. So on the right is the higher income countries and on the left is the kind of lower income countries. So back in 1948, our graph would have looked much more like the one on the left. So we're dealing with much more different things when the NHS was originally set up. So let's have a look at a few of these. Obesity is obviously the big one. So it's pretty much a global epidemic nowadays. So most of you know probably BMI of 18 to 25 is normal. 25 to 30 is classed as overweight and 30 plus is obese. So in the UK at the moment, 26% of adults are obese and 20% of year 6 children are obese. So that's not overweight, that's obese. In 1617, over 600,000 hospitals admissions were related to obesity, which is an 18% increase on the year before. I mean, I just find these figures quite staggering. Deprivation is a huge factor, mainly for children and women, weirdly, men not so much. So about, a quarter of children in deprived areas are obese, compared to 11% in more affluent areas. It's difficult times. So looking at, why this might be the case, it's difficult. I mean, there's lots of different factors, but things like eating fruit and vegetables. So only 26% of adults consume 5 portions of fruit and veg a day, and only 15% of children age between 5 and 15. And that's actually fallen from 23% in 2016. So we're actually getting worse, we're going backwards. And the thing with obesity is that it's both a disease in itself and it's also a driver of other diseases. And one of those diseases that it drives is type 2 diabetes. So we've heard a bit from Nick already about type 2 diabetes, but this is a huge cost to the NHS every year and it's just going up. So it costs the NHS over £20 billion a year, which is 10% of the NHS budget. So 8.8 billion of those is directly on type 2 diabetes and 13 billion is kind of on the problems it causes as well, complications and things. Now that's set to rise to about 35 billion, approximately by 2035, which is nearly 20% of the NHS budget. That's on one disease that's largely preventable. What's another one? Cardiovascular disease. This is the biggest killer in the world now. So there are about 7 million people living in the UK with heart disease, and it causes a quarter of all deaths. So that's 420 deaths a day, a death every 3 minutes. It's quite scary. So that costs the NHS about 9 billion a year. So we're really good now at keeping people alive with heart disease. Death rates have fallen dramatically since the 1960s, which is great, but obviously then more people living with a chronic disease. So there are some risk factors to heart disease that we can't change. Okay, so your age, your sex, your family history. But some we can do a lot about. So obesity, obviously, what you eat, how much you exercise, even your blood pressure. What's the next one? Cancer. So Nick's already told us. So anyone born after the age of after the year 1960 has got 1 in 2 chance of developing cancer at some point in their lives. So that's, half of us, basically. 38% of cancers, they think, are preventable through lifestyle modification. That's quite a big number. So 3 of the 4 most common cancers in the UK, breast, lung and bowel, have significant factors that are lifestyle related. So it's really easy, I think, to make the link between smoking and lung cancer, but maybe not so easy to make the link between obesity and postmenopausal breast cancer, or bowel cancer and maybe a low fibre diet, or inactivity is a huge a risk factor for bowel cancer. So I'm not sure, there's quite a lot of promotion now about obesity and cancer, and I think that's really important because I'm not sure the connection is always made between lifestyle and cancer. Oh, we'll get to that in a sec. So the NHS budget is about 130 million a year, that was for last year. The Department of Health budget, they think, will grow between about 1.2% between 2009 and 2021. But actually that's way below what they think is needed. So the projections from the Office of Responsibility suggest that they need at least 4.3% of an increase in budget, which that's a huge shortfall. So with all our chronic diseases impacting our health and our healthcare system, a lack of funding and all the other issues that we're facing, what does our future look like? Well, I've already showed you, but it's maybe a bit depressing. But I'm going to try and keep positive. So the NHS wrote a plan, hurrah, called the 5-year forward view. So this was written in 2014, I think, and this is mainly about the GP stuff. So it covers everything, but I've concentrated on the GP stuff because that's my field. So a lot of it is basically cost saving, which is fine. But there's some really positive things in here. So healthcare's changing hugely, and GP surgeries, we're really having to kind of keep up with the change. You won't find that many traditional surgeries left now, so just doctors, nurses, and maybe some admin staff. We're having to branch out. So I know, so you can see sort of developing the team. We've got much more multidisciplinary team now. So where I work, we've got paramedics that are doing a lot of the visits. We've got nurse practitioners doing minor illness and chronic illness care, pharmacists taking care of a lot of the prescription work, and there are also places that have physicians associates and social prescribers, and all these people are hoping to expand the workplace and give patients better access to care, and also take a little bit of strain off the doctor, so the doctor doesn't have to do absolutely everything in terms of all those things. So they can really concentrate on, I suppose, the actual medical care. So group consultations is another really interesting area. I'm a member of the British Society of Lifestyle Medicine, and in the conference in Edinburgh earlier this year there was a big emphasis on group consultations. So it's basically where huge group, so it doesn't, numbers are variable depending on where you are and what you're doing, but somewhere between sort of 5 and 20 patients at a time, all being seen with the same condition. And it's been trialled in some areas, I think Croydon and Slough particularly, and other places in the country, and it's working really, really well for a lot of conditions, particularly type 2 diabetes, where the results have been really good. And the last one is working at scale. So I think time is short for small practices, and they're just becoming less sustainable, and we're being expected to provide longer opening hours, greater choice, and more services for patients. And patients are becoming, demanding. They're expecting all of this from their practice, and single-handed GPs and very small practices just aren't able to do this. So we're kind of having to come together to provide the best care for our patients. So let's think positive, and what can we do? I mean, I think this is the future, isn't it? Lifestyle medicine. If we can actually prevent all these preventable diseases, just think how much money there would be in the NHS for things that we can do less about. So the infections, the accidents, all that kind of stuff, the stuff that the NHS was really designed for in the first place. I mean, I don't know about you guys, but I don't think there's another country I would rather be in for emergency care. I mean, I just think the emergency care in this country is absolutely brilliant. So the NHS staff, what can they do? They're working really hard under really difficult circumstances. We're genuinely struggling sometimes to provide conventional care at a really high standard every day. So please forgive your doctor when they don't know all about the supplements you're taking for osteoporosis, or whether you can try an alternative form of therapy for back pain, or what food you should be eating if you have thyroid problems. We've got quite a narrow area of care, and we're only allowed to refer to certain places. So they're taught medicine in medical school, which doesn't really include much nutrition, certainly, and not much sort of general lifestyle medicine. So we do biochemistry, physiology, pharmacology is a big thing. And, you know, complementary medicine just doesn't come into it. But that doesn't mean they aren't always interested. So some aren't. I'll hold my hands up. Some are not interested at all. But lots are. So do start the conversation and read a lot and do lots of research. But just make sure what you're reading is scientifically backed up and credible, because we have quite a few people bringing in clippings from the Daily Mail, and I'm telling you, it doesn't go down that well. So, you know, doctors and healthcare staff are generally intelligent people for the most part, and it's not that they don't care or that they just don't know, and they're flat out with a day job. So what can we as patients do? I've kind of touched on it a little bit, but do educate yourselves. You know, do the simple things. Eat your 5 or maybe 10 portions of fruit and veg a day. Do your 150 minutes of moderate intensity exercise a week. Take some time for relaxation, stress reduction. Try and get your sleep 8 hours if you can every night. And doing all that is a great place to start. And I think days like this are amazing, and I kind of feel like I'm preaching to the choir really, because you're all here already. But yeah, just education and educate yourselves. And if you need help as well, why not see a nutritional therapist or a mindfulness teacher, do some yoga, take a yoga class, join a walking group if you want to get, you know, a bit of sense of community, and do some exercise at the same time. So wherever you need some extra motivation or advice, just seek out the right person that can help you. We all need to take, I think, a little bit more responsibility for our own health. The NHS can do so much, but, you know, it's all about, you know, it's about you. You need to do what you need to do for yourself. And no one else can really do it for us. And I don't really think that's the job of the NHS either. The NHS will be there when things go wrong, most of the time. But we need to take charge of our own sort of health destinies. So that's about it, really. Thanks very much.
Thank you. Do we have any questions for Claire?
I have
Yes,
one.
hi.
Hi, it's not so much a question, it's more just throwing something else into it. And that's I'm here for personal reasons, but also you just sort of picked another aspect of my life, because I'm a teacher.
Mm-hmm.
I'm a science teacher, and the graphs you showed about communicable and non-communicable diseases, we are teaching that now as part of the new GCSE. Children now are having lots of lessons on exactly what you've just been talked about, and that's amazing.
Yeah.
But my worry is, and I work in a very privileged environment, my worry is the children who are not in that privileged environment.
Yeah.
My worry is children I'm teaching are hearing it and they're relating to what's going on at home with diet and lifestyle choices, and they can go home and the money is there to buy the food that has the better nutrition and
Yeah.
so on. My worry is what's happening in inner cities where money isn't available and the children are hearing it and wanting to do it, and then they're simply not able to follow these guidelines because mum and dad don't follow these guidelines.
Yeah.
So I just feel passionate that it's got to be, the education's got to start with young children.
Yeah.
But I worry that gulf is going to become more and more apparent.
Yeah, I think you're right. The inequalities are huge. where I work in Oxford is sort of well, it's on Cowley Road. I don't know if many of you know Oxford, but it's quite a diverse, I suppose, group of patients, and we see a lot of. I mean, that's the problem, isn't it? There's sort of generations of people that haven't taken real care of their health, and they just don't know. They just don't have a clue. Like, I'll talk to my patients about, mums who are giving their kids, crisps and chocolate and sweets when they're teeny tiny, or sort of fizzy drinks in a bottle, and they just don't know. They just don't realise. So I, just trying, getting the conversation started is so important.
But the problem is those things are also very cheap.
The junk food is incredibly cheap, so it's...
I mean, it is cheap, but I actually don't think fruit and vegetables are that
No, it's true, but if you go into any garage, for example, any garage forecourt, you kind of see
and they're always on
what
offer as well, aren't they? So, and they're always right there when you walk, I go to the supermarket in Cowley, and the fruit is way at the back, so when you walk in the front door, it's the crisps and the chocolate and the sweets, it's just right there, and all the Krispy Kremes right next to the door. So yeah, I mean, it all has to change, but I think you're right, education from the word go is really important, and the schools, I know the schools are struggling, but yeah, it would be nice to get into schools, I guess, and do some work.
Thank you so much, Claire.
Okay, thank you.
Another bit of stretching with Nikki and Dave.
This next one is a bit dependent on rights and lefts, and those of you that know me from yoga know that I'm absolutely hopeless with lefts and rights. But if everybody can pick up their right hand, okay? Now Dave and I are opposite you, so we're going to be picking up our left hand, okay? So we're going to do a little bit of stretching down through the right side of your body, our left. And then we're going to make a comparison of what it feels like to release tension through one side of the body compared to what it feels like to hold tension on the other. So just come forward from your chair. Remember your puppet strings, if you've forgotten them, tummy, back, chest bone, crown of the head, collarbones, open the heart. You're going to breathe in, reach up with your right arm as high as you can. And as you breathe out, take that right arm over to the left. And again, breathe in, reach even higher. Really stretch up from your sit bone to the fingertips, and breathe out, taking the arm even further over. And one more, breathe in, really stretch up, and breathe out, take that arm over, really reach. Okay, lovely. And then breathe in as you reach up one more time. This time, breathe out, fingertips on your shoulder. You're going to breathe in, take the elbow up towards the ceiling, and as you breathe out, draw it well back and down. And again, a deep breath in, take the elbow up as high as you can, and as you breathe out, draw it well back and down. And one more really big, deep breath in, and breathe out, draw it well back and down. Just give that arm a bit of a shake out. And then the last one, you're going to breathe in, lift your shoulder up to your ear, and with a long sigh, just drop that shoulder down. And again, deep breath in, and drop it down. And one more, breathe in, lots of noise. Okay, lovely. Now just sit for a moment, maybe even close your eyes and see if you can feel your body, the difference between the right shoulder and the left. Now, there's no rules, there's no getting this right, but you might notice something like your right shoulder's a bit lower. It might feel more alive of sensations like tingling or a warm flow, maybe more spacious than the left. Just be aware of what it feels like to release tension compared to this held feeling on the left side. Now we do the same on the left. So breathe in, reach up, high as you can, grow taller and taller, and then breathe out, taking the arm over. The out breath is when we relax. Breathe in, re-energize, and breathe out. Just soften and release and relax through that side. And one more, breathe in. Looks amazing, the sort of wave, and breathe out.
Light is that?
Breathe in as you reach up. As you breathe out, fingertips on your shoulder. Again, breathe in. Reach up as high as you can. As you breathe out, draw that arm well back and down. And again, deep breath in as you reach up. As you breathe out, draw the elbow well back and down. And then one more. Breathing in, reaching up, elbow well back and down. Lovely. And then just give that arm a really good shake out, really shake out. And then the last one, you're going to breathe in, lift your shoulder up, and breathe out with a sigh, drop it down. Again, breathe in, and drop it down. And then one more, breathe in, and drop it down. Lovely. Okay, have a little bit of a wriggle like we did before. Keep telling your body it's a very movable, flexible body. It's not stiff and rigid, full of tension. Close your eyes for a moment, see if you can feel that difference now in the left shoulder. More open, warmer, more alive, full of sensations. Lovely. Okay, and then the last one, just open your eyes. And one last thing I'm going to suggest to you is see if we can just bring the mouth into a little bit more of a smile during the rest of the day. A smile is fantastic for the body. When you smile, the body thinks you're having a really good time and the body can relax. When you're frowning, it feels something's not quite right and it tends to stiffen up. Smiles are fantastic.